you need to be willing to accept the realm of uncertainty, which, by the way, is universal. There is no certainty in life, and certainly not in the realm of prostate cancer and prostate health. You have to be comfortable with your decisions. What if things progress? You have to be comfortable that you made your best decision with the information and with the values that you place at a high level. The presence of a libido and a capacity for sexual activity is a sign of good health. Now, what you do with that is your prerogative. This doesn't change just because you have an elevated PSA, an abnormal prostate MRI, or even prostate cancer. Whether it has been actively treated or you're in a watchful waiting mode, you need to be thoughtful about how you want to manage your sexual vitality. Of course, my advocacy is to avoid the biopsy in the first place. However, I respect the fact that some of you will choose a different path, and maybe you already have. Do not despair. There are things that you can always do to preserve vitality, and it starts with acknowledging, what you want to achieve. Have a conversation with your partner. If you don't have a partner, have a conversation with yourself. This is not out of bounds. This is central to the entire vital living dynamic. Not too many men or women would voluntarily relinquish their sexual vitality. And there's nothing that says you need to do that just because of a diagnosis or a risk. All right? So let's erase some fear factors. First of all, it does not harm you, your prostate, nor does it affect the pattern of your prostate cancer if you have orgasms, if you have sex. Now, will it help protect you? That's less is known about that. What can be said about frequency of orgasm from a landmark study in 2004, Journal of the American Medical Association, it was associated with a 33% reduction in subsequent prostate cancer, and they followed those men out 10 years. Now, bear in mind, this is an observational cohort. It doesn't prove causality. Nevertheless, it's kind of comforting. Now, frequent orgasm in the study, they defined it as 21 times a month. Yikes. You can wear out your partner, but you don't need to have this with another person. Furthermore, I wouldn't advocate that you force yourself into an activity on a regular basis with the abstract hope that it can help. So there are other variables. One thing we know is that men with a low testosterone level have a higher incidence of prostate cancer. Now, that's a little different from saying if you replace it with testosterone therapy, it'll lower that risk, but that could be a variable. Now, how about the use of enhancers for sexual function? Now, one of the coincidences or one of the phenomena is men who are diagnosed with an elevated PSA or an abnormal prostate MRI or even prostate cancer typically occurs at a time in life when testosterone levels may be naturally declining and sexual vitality and erectile function may not be quite as robust. Now, we know that tadalafil, Cialis, or sildenafil, Viagra, these are known as PDE-5 drugs, phosphodiesterase drugs. These can help improve circulation to the penis. That's a good thing. Sometimes they work great, sometimes not quite enough. What we know about tadalafil in particular is that it can be used every day without risk of harm, up to 20 milligrams every day. It correlates with better blood flow to the penis, better erections, better urinary flow, a reduced risk of heart attack, stroke, and dementia. So I like that as a foundational piece. Don't be shy to introduce this into your treatment regimen. Make sure, of course, you're working with your doc to ensure monitoring. In many cases, I will add sildenafil or Viagra to the tadalafil. So tadalafil in the morning, later in the day, a dose of sildenafil, typically about 3 hours before activity on an empty stomach can enhance erections. Now we're talking about erections. See, men, we tend to think about erections as being the equivalent of sexual activity. But let's take a step back and broaden our perspective. The erections may or may not be sufficient for penetration. That may or may not be a critical element to your sexual vitality, but don't be shy, guys, if the erections are not full mast. Your wife, your girlfriend, your boyfriend, your partner still loves you. They still want to have physical intimacy. You need to get over any kind of awareness or concern, right, about that. So yes, I want to help you maintain your best erectile function. But we're going to take a side bend here to talk about sexual vitality in a different way. Remember, for women, only about 15% of women can achieve climax through penetration alone. They must have clitoral stimulation, either before, during, or after. Men, if you're not skilled at clitoral stimulation, it's time to acquire the talent. This is not a natural, organic phenomenon that we are inbred with the knowledge about how to achieve. Procreation does not require a woman to have an orgasm. A little bit unfair, I don't know why, but that's just the way human beings are made. However, bonding and intimacy very much enhanced by that activity. So think about clitoral stimulation, either manually or orally. Yes, guys, that works beautifully. Or with vibration devices in the bedroom. So as you mature, as you get over your youthful inhibitions, as you get over your pornographically induced perceptions of male dominant sex, you could start to become a lot more creative. And that is helpful. There are observational, let's call that a parallel masturbation form of sexual activity. Whereas a woman is getting clitoral stimulation, the guy, oftentimes, men can achieve climax without a completely full erections. Having the pressure to penetrate can sometimes be a barrier toward enjoying sexual vitality. The penetration, of course, is wonderful when it can occur, but if it can't, don't let it stop sexual connectivity. So think creatively, don't be shy, don't be inhibited. This is not a time to think about the biases against sexual vitality. You know what? It's interesting to me that as docs, we don't often ask about sexual activity. How many times do you have sex? Do you have orgasms? Why ought this to be sort of avoided? It can be a little uncomfortable, but if you don't talk about things, guys, you can't achieve solutions to problems. Now, when it comes to talking about sex with your partner, it's better to do it outside of the moment of intimacy. Otherwise, it feels like a review or a critique. Gee, how did that go? I give it 3 stars. Maybe the next day, maybe another time or environment. Maybe you're better off texting, writing, what do you like, what do you not like? These conversations can really help enhance the bedroom or wherever you choose to have sex, the kitchen, I don't know. So point is to be broad-minded and do not let challenges with erection cause you to turtle up and quit engagement. All right, now let's go back to the actual preservation and reinforcement. Sometimes a needle biopsy can be disruptive of sexual activity. Maybe it's psychological, maybe there's nerve disruption, but that can't happen. So think of your pharmacologic support for that. Concurrent with that is the need for testosterone. Now, in some cases, testosterone can be safely administered to men with an elevated PSA, even to men with an abnormal prostate MRI. You need a very knowledgeable clinician with an open mind to contemplate this. And you need to be willing to accept the realm of uncertainty, which, by the way, is universal. There is no certainty in life, and certainly not in the realm of prostate cancer and prostate health. If you go on testosterone and you have an elevated PSA, will it make things worse? Maybe, but the evidence is not quite that direct. The idea of testosterone pouring gas on the fire is a long-held bias, concept, belief, if you will. It's being challenged. So there are good reasons to consider that as a worthy area of challenge. There's actual evidence that testosterone therapy can have a role to play. We'll talk about that at another time. The point of this conversation is that if you're on testosterone and your PSA spikes and you have an abnormal MRI, it does not mean that you need to suspend use of testosterone. I have men in my practice who are doing both and are enjoying a high quality of life, as well as stability of the underlying PSA and prostate anatomy. You have to be comfortable with your decisions. What if things progress? You have to be comfortable that you made your best decision with the information and with the values that you place at a high level. So testosterone, not off the table. Well, what else is out there? If you're struggling with erections or have had any kind of a procedure, a surgical procedure, radiation therapy, the penile pumps actually have a role. I know they're comedic. I saw Austin Powers and I get it, right? But this is about overcoming inhibitions. This is about living boldly. The vacuums can help a few ways. First, the vacuum can help draw blood into the penis, helping it to become engorged. Then a ring is placed at the base to maintain erection. Totally legitimate, safe, can oftentimes be very effective. The vacuum can also be used as part of penile rehabilitation. If you're not engorging your penis periodically, you can have penile atrophy, fibrosis. So the idea of use it or lose it applies toward the anatomy of the penis, the corpus cavernosum, those hydraulics within the penis that make everything work. They have to be maintained. So a pump can be used outside of sexual activity as part of a penile rehabilitation and maintenance. A few other things that I like. Peptide therapy, interesting. Now peptides, I'm referring to, let's call these functional peptides, not available in the pharmacy, but they are available from legitimate FDA monitored compounding pharmacies at the direction of your doctor. Guys, don't go on the internet and self-treat. It's a black hole. But you can ask about the following two peptides that have value. One of them is melanotan, not melatonin, but melanotan. Melanotan is a peptide that stimulates the part of the brain where sex drive, erection, and orgasm live. So it'll enhance sexual responsiveness in men and in women. It also will cause skin pigmentation. It stimulates the melanocytes to release pigment, giving you a tanned color. Some people like that. It's a non-sun-induced tan. In fact, the researchers have hypothesized that this may be protective against skin cancer since tanning is the body's natural defense. That is an unknown. So we really don't know what effect it'll have on skin cancer. Side effect of melanotan can be nausea if you take too much. And some folks just don't like the tanning phenomenon. The melanotan can be used on a regular basis, typically 3 times a week. Another peptide that I like is PT-141. PT-141 is a cousin of melanotan. It has more sexual stimulation and less skin pigmentation. This peptide can be injected typically 6 hours before sexual activity, stimulating the part of the brain where sex drive, erection, and climax all live. And that can have a durable effect. When you do it 6 hours before activity, I've seen it last for 24 hours, and it can be used several times a week. Of course, this requires a degree of planning, premeditation. That's generally a good thing, right? We've talked about the 2 kinds of sex drive, libido, spontaneous and reactive. Spontaneous means that you're sitting in traffic, you're at work, all of a sudden you're thinking about having sex. That type of libido happens less as you get older, regardless of your hormonal status. But reactive libido, which means you start to have foreplay and everything shifts into gear, that can be maintained indefinitely. So the PT-141, a nice play, melanotan, a consideration. And these can be used in combination with the PDE drugs in order to enhance erection, which does nothing for libido, and the libido along with it. So putting these all together, guys, you can maintain healthy, robust sexual activity. It requires, above all else, the desire to do so. A loving partner would not abandon a critical part of the partnership without putting forth effort. So we'll talk more about this topic. I think it's super important and a little bit neglected. Until then, keep practicing. Don't quit. Don't be shy. Don't be afraid. Live life fully, all the time. All right, guys, talk to you soon.